Wonderful. So thank you both again so much for joining us and on this intimate fireside chat And Daniel Lobo here with me today is based in Mumbai and is the founder and CEO of BecauseYOU, a mental health social enterprise. And as someone who deals with mental health issues himself, Daniel started BecauseYOU to have a deep impact in the mental health space. He will be sharing his personal story with us this evening or morning, depending on where you are, and as well as the purpose and work of his organization and what it's been like through the pandemic. Daniel is also a stability leader with the Stability Network. And for anyone familiar with the Stability Network, we're a global community of individuals who are all living with mental health conditions and share our stories to inspire and encourage others. Great. Daniel, how are you doing?
Doing very well. Thanks for inviting me. I'm quite excited about this. I think the work of the Stability Network is really important. And yeah, I'm kind of, normalizing the conversations around, mental health is, I think, one of my primary goals in life. So it's lovely that I'm part of this network and I can kind of be of service in any way. So thanks for having me.
Thank you. It's really a pleasure. I'm very excited about this fireside chat. So thank you. Can you start off by sharing maybe what has shaped you in your life as a person and a little bit about your personal journey with mental health?
Sure, happy to. I guess where I can start is my mom and dad have had a huge influence on my life. I think they're pivotal to my journey. And on top of that, I feel my life experience, my career is the other side of what's really shaped me as a person. So I grew up in a very middle-class Indian family. My dad was a professor in English. My mom worked in the bank. My sister and I had a very free, loving childhood, I'd say. I have lots of fond memories of my childhood. And I think one of my favorite memories was of my dad teaching me how to play cricket. I still remember that very fondly. But then I think over a few years, I noticed that, the way he showed up in the world sort of started to change, right? And I didn't really know what it was, but it felt like my relationship with him kind of stopped in some ways. Many years later, I realized that he was diagnosed with bipolar disorder. He suffered from it for almost 40 years, and it shaped a lot of the way he was as a person. So my mom kind of, was, I think, the rock in our family. She brought us up. She kind of literally, I think, has shaped who my sister and I are in many ways. And I think a lot of who we are as people are because of her in many ways. So if I fast forward a few years, I became an engineer, a software engineer. I did that for a few years, and then I realized at some point that I wanted to do something more. I needed more purpose in my life. So I quit. I became a teacher in a slum school. I taught 61 kids in my class for 2 years. Life-changing experience. I think that was literally the first time in my life that my head and my heart were one, right? It really showed me what a purposeful life could be. And from there, for the next almost 10, 12 years, I worked for a social enterprise that works with very senior business leaders all across the world. And it was a transformational experience because I got to travel the world. I got to meet amazing people, whether it was CEOs of businesses to entrepreneurs to, leaders, inspiring leaders in slums, favelas, townships around the world, really looking at what leadership means. And that was such a pivotal moment in my life in many ways. And at the same time, I was traveling all over the world. And I think the kind of the time zones, the switching of time zones really had an impact in some ways, and it probably triggered off the hereditary, gene in me. I had a fairly intense period over a year where I went through my own journey of kind of intense depression, hitting very highs, the highs of kind of bipolar disorder. I was diagnosed with having bipolar disorder, and I think so that's my sort of way of how I entered the mental health space. And if I had to look back on it now, it's like I think if I had to come back as a dad, I'm now a dad. I have a toddler myself, and I now know in some ways what my dad kind of went through, right? And he didn't have the support. He didn't have the exposure and the knowledge that I have now. And it felt like like even though I probably lost my relationship with him towards the latter half of my my childhood, his life, I feel that relationship has become really strong in the last 6 years, because I kind of connect with him on a very visceral level right now. I know that it was probably really difficult for him, but he didn't have the tools that I have right now. So like as a dad, I kind of know now how important it is for the love, support, his own presence as a person made such a big difference on me that I now recognize. So I feel that, yeah, I mean, I feel even though he was not there in my life for a big time, but I know that he's had a huge influence on me. So yeah, that's I guess what shaped me as a person.
Thank you for sharing that. And I do want to give a shout out because you told me that your family is listening in. So I want to give a shout out to Daniel's family. Thank you for joining and for having such a big impact on Daniel. So yes, thank you for that. And zooming out now to this last year that we've all lived through, can you tell me how has the pandemic changed the way that you've seen people talking and thinking about mental health in India, and maybe what are some inherent challenges in India around this topic?
Sure, I can start with the challenges first. I think the way I look at it is there are structural challenges and then there are social challenges, right? If you look at the structural challenges, there's a massive shortage of mental health professionals in the country. So, the stats are we have one psychiatrist for 130,000 people. We are going to take 76 more years at the current rate of training to have the number of psychologists that are actually needed by globally accepted standards, right? So we are way far off from what is really needed from the mental health professionals' point of view. Less than 0.5% of medical graduates doing it every year have access to kind of psychiatry training. So from a policy level, we've got a really amazing Mental Health Care Act, which has just been implemented 2-3 years ago, and that's slowly starting to percolate through the system. But as a country, we are still our economy. We are still spending less than 0.05% of our health budget on mental health. So we've got some massive structural challenges that we need to overcome as a country. There are lots of initiatives, there are lots of amazing things happening within the country. But at the end of the day, the social challenges have always kind of been quite difficult for us, right? So there's a huge stigma in our country. Like I think globally it's still there, but especially in India, there's a lot of I would say there's a lot of myths, there's a lot of superstition around it. There's a big divide between urban and rural India. Still about 70% of India lives in rural places. So the few of us who are lucky enough, privileged enough to have access to social media, over the last 2 years, the conversation has started to open up, and especially with millennials. So the conversations I'm having with 20-year-old people are completely different from the conversations I'm having with 50-year-olds, right? So there is an age difference in terms of the stigma that's happening. But I think the massive difference in the social space is that we as children were never taught about emotional intelligence. We were not taught about what is mental health, what is well-being, how do we recognize some of the triggers. Like, we don't know what to do with this, and we don't talk about it, right? As whether it's Indian society or whether it's global, I'm not sure, but especially as an Indian society, we don't really talk about it. So if you just combine both the social and the structural challenges, we've got a long way to go. Now the pandemic really kind of opened out the conversation a little bit, I would say. People are starting to talk about it. There are lots of amazing organizations who are doing a lot of good work. And at the same time, it's still, the beginning, right? We've just started our journey with this. There's amazing work happening in communities. The community mental health models are, I would say, really progressive in India. Now people who have access to therapy and apps, all that is starting to happen online, so that's quite progressive in some ways. But at some level, it's still, at least my experience is, we talk about it a lot, but when it hits home and it comes to you and my family, we are still hesitant about talking about it. I still don't have a conversation with my close family in my circles. I've just started to have that because I've started being open about it. So the pandemic has definitely shifted the conversation, but I think have a long way to go.
I appreciate that discussion around the social and the structural need there and moving that needle along. And something you said stood out to me. You said there's many myths still that exist. Is there a myth that you want to come out and bust right now?
I mean, if I think about India specifically, we've, over the years, Bollywood has had a huge influence on our life. So if you still look at, at least, when I was growing up, there was a lot of, when you think about people with a mental health issue, it's usually someone who cannot function, right? So I think one of the biggest myths that I want to bust is that people with mental health issues, all of us are on the spectrum at some level or the other, right? There are some of us who are very high functioning. There are some of us who are at the beginning of the journey, but like my belief is that everyone can get through it. Everyone can go through that tunnel. And there is a lot of awareness that needs to happen. There's a lot of support. But I think the people with mental health issues, I feel there's a lot of wisdom and creativity. And I think that's something that people don't realize. And it's a myth that people with mental health issues actually cannot function, which if you look at my example, I think I can bust that myth myself.
I'd say it's busted. Thank you. For anyone listening now or listening to the recording, if you or anyone experiencing mental health issues, you can live a very full life with them. So
yeah, and I think that's why I love the Stability Network, right? We've got 250 people or so, all of us living with mental health issues, but still, obviously it's challenging. Obviously, so it's not going to be a cakewalk every single day, but many of us are still thriving, right? And I think that's a message we want to give to the world in some ways.
Yes, exactly. 200, I think as of today, 285 in 15 countries, wow. All living and working with mental health conditions. And I do want to share, because quite a few have been joining as we go. If anyone has any questions for Daniel, we will have time at the end for Q&A. So if anyone wants to start sending in questions through the chat, we will hopefully get to those towards the end. Great. So Daniel, can you tell me what led you to start your business, BecauseYOU?
Yeah. So where I left off was, I had this journey with mental health, with bipolar disorder, that sort of hit 6 years ago. And the last 6 years have been, I think at that time I had this view in my head that I want to live a full life, right? Irrespective of my mental health issue, I want to live a full life. I want to have a family. I want to have an amazing career. I want to travel the world. That for me was I was just set on it. And I said, okay, I'm going to do whatever it takes to figure that out. So the last 6 years have been trying to figure out what it is that works, doesn't work. I had to stop, pause, slow down, go on this journey, which made me realize many layers of my own identity as a person, right? And I think on one hand it was amazing because I think I've kind of figured out who I am as a person, what works. My awareness is, I think shot through the roof in some ways, in a good way. But on the other hand, it's been a lonely journey because no one really understands what you go through. And I feel when the pandemic hit, there was lots of external chaos, right? We've just got into lockdown. There was no travel. There was, I just had a toddler. I just had a child. She was 1 year old. So that that was a whole big change in my life. Our business was under lots of pressure at that time because we were a travel business, we were leadership, and everything immediately stopped, right? So some of us had to kind of take a step back and rethink about what we want to do in life. And I think at that point I realized that even though there was lots of external chaos, internally I was really stable. And I think for someone dealing with a fairly severe mental health issue, I felt that was quite an achievement, right? So I said, okay, as I reflected upon that, I think what I realized was because I was very focused on this inner journey of really working on myself, literally over the last 12 years, that had a huge part to play in it. And the other part was, my family, my friends, my colleagues. My wife has a huge role to play. She's amazing. And I think everyone really stood by me, even though they didn't really understand. So this community approach that I think made a really big difference. So, I think for me, this inner journey, as well as doing it in community, really stuck. And I said, when I looked around in the pandemic, I saw there was huge need. Suddenly the country, we were like, things that were repressed for many, many years has started to come to the surface. So I saw there was huge need, there's a huge opportunity, and I was very sure that there were lots of people like me. And I said, maybe there's something here. Could we go on this journey of self-discovery, but within a community, right? So that's how the idea of Because You hit, like in June of last year. And so we started with a very community-focused approach. But since then, it's kind of grown quite a lot, which I'll share with you. But that was the kind of the impetus and the catalyst, I would say.
That's amazing. And I love how the beginnings you talked about is that feeling of loneliness, of maybe feeling alone in the symptoms and experiences. And then possibly with what you were saying through the pandemic, with so many people experiencing maybe for the first time or maybe a heightened level of mental health issues, and maybe being more open about it, kind of breaking out of that openness. And it really seems like an opportune time for your business because the need seems so great. Have you felt that the business has, I hate to say benefited because of the pandemic, because that doesn't necessarily feel right to say, but you know what I mean?
Yeah, I mean, and it has for sure, right? I think for the first time we are starting to be okay with saying that something's wrong. I need a bit of support. And, whether it was providence or whether it was, clever thinking at that time, I think I started at a point where it felt like, we just hit this wave, right? But at the same time, what's happening now is there's a lot of noise. So there's lots of noise around mental health. It's like it's a buzzword. So I think my journey over the last it's been 10 months since I officially launched. I think my journey has been, how do we create something that's impactful, meaningful, that will build trust with people over the long term, right? Because I'm committed to doing this the rest of my life. But building a business in the pandemic is not really easy, right? And something that has such high barriers of building trust, the stigma is still very high, and I'm approaching it from a community approach, which is, let's get together in a group and talk about this, right? It's not even one-on-one, because the one-on-one offering services have blown up in India over the last 1 year. So we've got multiple really good as well online therapy services where you can get therapy very easily now for those who have it. But the space that I saw was missing was this community approach, where there are sort of support groups, there are thing which is still nascent in some ways, but I felt well facilitated group therapy spaces a community approach where we go with an individual throughout the journey, from beginning to wherever they want to be on the journey, I thought was missing. So the pandemic definitely amplified the need, and we are getting a lot of interest in many ways, but it's constantly changing, right? And it's completely changed. Like what I thought because you would be in the beginning is in many ways changed to now. It's a lovely journey, I would say. So yeah.
Thank you for that. I love that. So with your work being all around building this community and supporting those living with mental health challenges, can you share with me and those listening about the specific resources that you offer?
Yeah, and before the resources, I think I'd like to talk a little bit about the approach, right, and the philosophy. So what we are is we are a mental health social enterprise. We're a mental health business. We work with organizations and individuals to really place mental health at the center of their world. That's our purpose. We know that if you place mental health at the center of your world, it will have a ripple effect on every single part of your life. Right? So we want to literally unleash creativity and wisdom into the world. We feel that it's very possible, and we want to be that space that has the belief that all of us can go through this journey. We hold that belief for people. Right? So as we started doing our programs, we realized that the essence of what we do kind of filters down to 3 words, and that's connection, compassion, and wholeness. Right? So if you think about it, it's not just connection because you're coming in a group, but it's also connection with yourself. It's compassion, not just about with other people and having this journey with other people, but also compassion with yourself, because it's really difficult when you're in distress to sort of take care of yourself and be compassionate, right? And the wholeness piece is really central, because we believe that a person is whole, a person is perfect, and even though you might be in distress a lot, that is one side of you, that is one part of you, whereas you have access to all the other sides of you, which are beautiful, which have different qualities, which can be unleashed in many ways. So we want to be that person who keeps saying, you are a whole person, you are beautiful, let's figure out what it is that makes you shine, what are the gifts that you have, right? And we want to hold that higher belief for each person. So that's kind of our approach. We started with a community-based approach where we bring in people in small groups that go along a journey with us. So at the moment, the community has, in the beginning, we have a kind of a program, a 5-session program you could call it group therapy, where we've got a therapist, a person with lived experience, working with the individuals as a way to really reflect upon their own journey and gain tools and skills and all of that stuff, right? But the real intention is to build a little bit of curiosity in this way of approach, in this group approach, because it's brand new. Like doing this stuff in groups is very, very new, especially in India. So we want to build this comfort level, because once people come in, they love it. They love being in groups. They love suddenly seeing that I'm not alone. There are other people who are dealing with similar things, and it suddenly becomes oh, I see this. I can manage this in some way or form. So just this, I think that's one of the biggest resources that we give, right? The fact that we are a community, there are other people like us. All of us are on very different journeys. It's not that it's a community only for depression or anxiety. There are people who have come in who haven't been diagnosed, and it doesn't matter to us, right? In some ways, also because the statistics in our country is about 75% of people who probably have a diagnosis do not have a diagnosis because of the stats I just told you earlier about. So that's a logistical problem. On the other hand, I feel we are trying to go beyond labels, right? Labels are useful. They are, for people where it works, it helps in the maintenance. But for the rest of us, I think beyond a certain point, we are human beings, right? We got to treat ourselves as human beings. So that's what we focus on. So there's no entry barrier in that you have to have a diagnosis. If you have some sort of distress, if you are willing to work on yourself, you're welcome, right? So in terms of resources, the group approach is there. We've got, sort of monthly support sessions for our community. We are starting to build a kind of a therapy matchmaking system where, because we know our community really well and we kind of are building trust with therapists on the other side, we can kind of put them together. So we want to build that only for the community at this moment. And then the other thing that we're doing is we're looking at the holistic approach to mental health, right? Which is, it's not just about meds and therapy. That's really important and foundational. But what are the bricks and the mortar that go into the house? So, you know, what can you do as a person to really try out different things? So we've got different types of workshops by experts, which is everything from, you know, mindfulness to meditative art to, you know, the relationship between the gut and mental health, to, you know, how do you live with your values? How do you show up as your best self? So it's really like looking at the mind, body, spirit, and how do you work with all three of those elements in many ways. So one of my colleagues calls it, we want to be kind of a marketplace, a one-stop shop for anything that's related to mental health, and we want to bring in the people with different approaches to, you know, offer whatever we need to offer to people.
I love this holistic feeling. I want to shout out to the gut and mental health, because I think that's something that's not talked about enough. And we don't have to dive into that now, but just thank you for sharing that. And also this therapy matchmaking. That is an incredible idea. And I know so many people, myself included, have had such a hard time finding a therapist. And there are so many barriers with insurance. I'm not sure what it is like in India in terms of barriers. I'm more know what it's like here.
I mean, we're not even talking about insurance. That is like a long-term goal for us. But as I think one of the biggest challenges is still, it's even now, it's still word of mouth. It's we have lots of therapists out there. The really good ones are pretty much booked up because the caseloads are really high. So if I have an issue tomorrow, I'm going to go to someone who I know and I say, who do you know who I can go to? Right? It's still very word of mouth. And then the therapist gets a client who they may or may not know. It takes some time. Sometimes the client drops out. And the concept of therapy is still nascent in India, but it's still, I mean, I would say now the online therapy world has become really, really big, right? So I think what the difference we want to bring in is, because we know the community really well, we work with them right from the beginning. We kind of know that, you know, this is the kind of work that this person might need. And we, you know, on the therapist side, we go to them and say, over the last 10 years, what's your impact been? Who are the type of people you have found the most impact with, right? And then we kind of match it. We don't know if that, you know, it'll probably, you know, be very impactful. It might still need some trial and error a little bit, but we think it's going to be a powerful offering in the future.
That's great. Thanks for sharing about that. And I'm sharing your link once more in the chat for anyone
thank you.
Who joins.
So that's, sorry to cut you off, but that's one side of the business, which is the you know, B2C, the consumer, the, you know, one-on-one kind of work with individuals. The other side, which has kind of kicked off, and I don't think you know about this since we last spoke, over the last 6 months, we've got a lot of interest from organizations to do work with us, right? And I think right from the beginning, I was very clear on saying, if we work with organizations, it needs to be deep, impactful work where we are embedded in the system. So the type of work that we're taking, we're lucky enough to get people who are asking us, who are trusting us and saying, come and do this for a longer period of time rather than one-off workshops. So we've got 3 different, I would say, products of sorts, where one is kind of a low-touch well-being circles, where again it's that holistic approach, whether it's mindfulness-based practices, whether it's, you know, meditative art, that sort of thing, where you could do that with, but you go through a journey as an organization, right? That's the kind of a low-touch product. 2 other very different products is one working with an organization on building a culture of psychological safety, right? And we've just kicked off about 3 months ago, we've kicked off a 1-year-long project with a UK-based not-for-profit, where it's working with the leadership team, the CEO, the executive team, all 100 staff, as well as, you know, putting in internal comms, campaigns, and so on. So it's a very intensive culture-building piece of work, which goes on over a period of 1 year. And the third product, if you want to call it, is something that came out of the need of COVID, where this is especially for NGOs, not-for-profits, and social enterprises working in communities where, there's a lot of distress, grief, death that's happening in communities because of COVID, especially the second wave in India. And people who are working on the ground have suddenly become first responders. They don't have the training to deal with death and grief, but they are suddenly taking this on as a first responder. So we've developed a program where it's an experiential, how do you work with secondhand trauma? How do you release it from your body? And how do you, gain the capacity and the strength to deal with these sorts of traumatic events on a day-to-day basis, right? So that's, I would say, a third piece of work that we're looking to develop. And the idea really on both sides is this year is a very experimental year. So we are trying out lots of different things. And by early next year, we'll kind of have a really good sense of, okay, here are 2 or 3 templates on the B2B side, which which will really work. Here are some case studies. There are some impact reports that we feel have a deep impact on the business side. And on the individual side, we're still looking to build out this community. It's still slow. It's still growing. But we think we've got something there, and we're looking to build on that. Now wow. I'm done with my Because You story, I think.
No, this is amazing. You are certainly keeping yourself very busy. That a lot of that was new to me. So congratulations on these new realms of working with organizations and the psychological safety and secondhand trauma that's very needed and really great to hear. So thank you for that word. Daniel, can you tell me maybe what word of encouragement do you have for anyone who is listening in live or to this recording who might be struggling with their own mental health issues brought on by the pandemic, or that they've been experiencing for years and maybe never sought help for?
Yeah. So I think something we need to recognize is that we are going through an unprecedented level of change, right? So we are in a pandemic. We've got the climate change pandemic. There's huge inequality in the world, and I think that by itself is so massive that obviously, like, a lot of us are struggling. A lot of us find it difficult. And I think whatever we are doing right now, even though we think it's not enough, is what you need at this moment, right? It's not possible to deal with so much of change really well, right? So we need to evolve and we need to kind of be compassionate with ourselves. I think my kind of, one of the things I've heard, which I found really beautiful, and I always think about this, is when you go through distress, it's almost like, a dark cloud, right? The dark cloud is there. It may be there for a day, a week, a few years, but it's a dark cloud. But at some point, that dark cloud is going to move. And we need to recognize that we are the blue sky behind. That's it. We are the blue sky. And I always find that useful when I'm going through a lot of difficult stuff. And I think that's my word of encouragement for anyone who's going through difficult stuff right now.
And this next question and comment, it's really deep thinking that has gone into making this organization. What is the measuring stick that you use for success?
Yeah, it's a fantastic question. I think I would say that question can be answered on many different levels. On one level, we want to have a deep impact on a person, right? On each person that we work with. So, and that goes from a person who has suddenly realized that by writing a blog with us, it has made them reflect on their journey and realize that they are actually a resilient person. And we've had these stories coming up in the community, right? A person has written a blog and it has suddenly opened up the conversations with their friends. They've gotten, closer relationships. They've realized that, people are realizing the strength and the challenges that a person can go through. And that is a huge success for me, because I feel any change in a relationship is big. On a little bit of a macro level, I think if we can bring a organized, collaborative, holistic approach to mental health in India, it's a massive success for me, right? If I want us to go beyond a biomedical approach to mental health, like I feel the work that I am doing is complementary. It is additional to everything that's already there. It's not a replacement. But the moment we realize that, we have, lots of tools within our disposal, we recognize that we have the power within us to kind of have change. It takes out this dependency on a biomedical approach to mental health, right? So that is a very long-term view, and I think that's a huge thing. I would definitely say normalizing the conversations is a success metric for me, which is why conversations like this really help. I would recommend anyone listening to sort of follow our Instagram account. It's at BecauseYOU.in. We do a lot of conversations there. We're starting to talk ourselves as a team, as a community, just normalizing that this is life. All of us go through this stuff, right? Let's talk about it. It's okay. I think normalizing conversations is a big success metric. And from an organizational point of view, a success metric for me is when organizations truly get what a safe culture is, what a psychologically safe culture is. That is huge. And I think, if people come back and want to work with us even more, I think that's a good indicator of success, right? Not just 1 year, come and work with us even longer. I think that'll be a good metric.
I want to end on asking you what your hope for the future of mental health in your community is and in our world.
Big question to end on, huh? So I think for me, on one level, there's a huge piece around deepening awareness, especially around just the education of mental health. It's not an easy subject. It's very complex. When you go beyond the biomedical approach, there are lots of different aspects that really impact our mental health, right? So that's one, especially with children. I think, my wish is that we raise our children to be emotionally conscious beings, right? I think that's the biggest gift that we can give to our planet. The second one, I think for me as a country especially, I think bringing together an East and West approach to mental health is really important. So as a culture, we've always had, with yoga and Ayurveda, we've had a holistic view of health, right? It's mind, body, spirit. We've always talked about that as a culture, and we've somehow lost that. So if there's a way to bring that back, put it together with the best of Western medicine, that's a wish that I really have. And I think, finally, what I said in the beginning, that recognizing that people who are going through emotional distress, we are inherently wise and creative, right? And once that is unleashed, the world will be a beautiful place. So I think I have that belief. All of us, if we can have that belief, it'll be amazing. And if we can love and support the people around us who might be in distress, I think that'll go a long way.
Thank you, Daniel. And really, I know that this is going to continue, to impact so many people in your community. So I just thank you for the work that you're doing. Yes.
Such a pleasure. And yeah, again, like I said, I love being part of the Stability Network. I think the work is so important. It's a lifelong journey, and we've got some awesome warriors with us. So thank you so much. I'm going to go head to the park and be with my child now for a little bit.
Great. Sounds great. Thank you. Thanks so much. Bye. Take care. Bye, everyone.